Hello, I'm Heather Herlock, editor-in-chief of Mindful Magazine and mindful.org, and welcome to the Healing Healthcare Summit. Today's theme is healing burnout. And all throughout the day, our various talks are looking at everything from the latest research on neuroscience of mindfulness to the caregiver's experience during the pandemic and practical tools for building capacity individually and organizationally. This session is called Acknowledging Burnout, Getting Started with and Sustaining a Mindfulness Practice as a Busy Healthcare Professional. And my guest is Mark Bertin. Dr. Mark Bertin is a board-certified developmental behavioral pediatrician. He's an assistant professor of pediatrics at New York Medical College. He's on the faculty of the Windward Teacher Training Institute and on the board of the directors for the American Professional Society of ADHD and Related Disorders. He's a mindfulness facilitator as well as the author of The Family ADHD Solution, Mindful Parenting for ADHD, and How Children Thrive. Welcome, Mark.
Heather, thank you. Happy to be here.
Thank you for joining us. I want to start by just noting that this is a pre-recorded session, and today is January 7th, and we are again in the middle of another COVID surge, which is really affecting our hospitals, affecting our healthcare professionals again. And I want to just ask you, if you can talk a little bit about how mindfulness can really serve when we're talking about this level of burnout.
Well, thank you. And I think, well, actually, I'll start a little more generally than that by saying, like, clearly, um, we can't fully acknowledge the experience like everybody individually has had in setting up a talk like this. And I think that's,
Mhm.
really important to start there because we can talk about resilience as a whole and managing burnout, which I will in a moment. And yet, people have obviously had also pretty extreme and devastating experiences too. So, so in getting started with today's session, though, I think it's really important to just reframe what mindfulness is in
Mm,
helping people understand how to engage with it during a crisis like this. And there's often a misperception that what we're talking about specifically is calm or a quiet mind or all these sort of unsustainable visions of perfection. And I think one of the things that causes people to either not even sign up in the first place or just quit on practice is when their perception is, I'm supposed to make myself relax or I'm supposed to make myself whatever the picture is. So the reason mindfulness can really help with resilience really is the idea we're talking about overall is because that's what it's meant for. The practice is one of trying to build the traits that help us live with more resilience, with more clarity, with kind of whatever we're facing. And and having heard myself say that, I'll start with something I often start with talking about mindfulness, which is one of the things that helped me engage with it. I was first got really lucky and was taught a little bit of it as a resident, is that one of the very basic teachings is this idea of asking yourself when you hear anything about this, is it true? Like, don't
mhm,
get caught up in just taking it at faith and don't get caught up in the language specifically. You got to really ask yourself, like, does this stuff make sense to me? And then nothing I say today is going to change anybody's life in any small way unless they actually go out and do it.
mhm,
So the foundation of mindfulness is just realizing that we tend to get caught up in reactivity, caught up in a sense of autopilot, that there's a real serious implication to the fact that we're not giving full awareness to what's actually going on. It's not a cliche. I mean, we can talk a little bit about today about why that actually matters. And that if we practice things that help us stay more settled or stay more patient with discomfort, that over time helps us sustain our resilience in many different ways. Actually, it has many layers to it. So that even in the middle of a crisis, we have to start with enough self care to sustain ourselves, to keep going.
mhm.
And again, the cliche in mindfulness is often that we're going to be sort of happy and blissful through anything, and that's not it at all. I can promise you, I haven't been happy and blissful through all of the pandemic.
Yes.
But the point is that it lets you navigate it more skillfully. So on a practical level, what that could just be is sustaining enough of a practice that even though in some other time you'd do something more intensive or you'd have time for a little bit of, free time on the weekends or whatever else it is, but you sustain enough of a practice to sort of get out of that loop of stress and reactivity we all fall into so easily.
Mhm.
Um, and that begins to influence many other things too.
Yes, thank you for um, describing the practice in that way. I really appreciate it. I think when we're talking about the healthcare community, we're talking about a group of people who see themselves as very resilient, who have to be resilient to be in the job they're in. And I sometimes wonder if when we use that word, they're like, well, I have that. I am that already. Can
Sure.
you talk a little bit about the practice element of it and
Sure.
really what when we talk about expanding capacity, especially in
Yeah.
a moment like right now when it might feel like, oh, I have expanded my capacity and I have met
I've
my
sort of
limit.
stretched, yeah, stretched it to the max.
Yes. So you talk about that a little bit?
Right. Well, I think it's important. First of all, let me just define a couple of terms because we haven't really done that in terms of, first of all, resilience is our ability to bounce back from challenges. I think that's the simplest way of looking at it.
Mm-hmm.
And, mindfulness kind of has two ways we're using it for anyone unfamiliar with it. Actually, I could almost add a third because I think in the West it's being used even a little differently. But mindfulness meditation is one thing. And the best way to think about that is um, it's a way of building traits that are going to spill over into everyday life. So one thing we say when we talk about mindfulness sometimes is, is referring to the specific type of meditation, which is something we need to talk about today because I think it's also, I think reframing that makes it easier to practice it. And then the second thing mindfulness refers to really is awareness, which is a way of living almost, of just trying to be giving more awareness. I think people often say full awareness, but that's not particularly possible. We're just aiming to give more awareness to what's actually going on in front of us. So for a healthcare provider, I think a simple example is, even if you're having a busy day that's all over the place, clearly, if you go into the next room with a new person, a new patient you're meeting, the most important thing to do is try to give full awareness to that moment, and that's a small example of where it's a pretty powerful one actually, but a small example of where mindfulness is a way of living. It's not just the practice itself.
Yeah.
In the West, it's really encompasses a whole bunch of other practices too, but maybe that's not the topic for today. So what that really means in healthcare is that there's often um, a perception that's almost like a grin and bear it type perception of like we just got to be resilient, like I got to be tough, I got to be resilient, I got to keep going, which is true on one level. Clearly, it's part of you got to, that's our job. But it's also false on another level because there is, I mean, certainly my experience of medical training, and it's been a while, but I don't know that it's changed all that much, is there isn't all that much emphasis placed on the fact that we have to take care of ourselves to take care of other people.
Yeah.
And it's one of those things, as we start talking about all these things that build resilience, I sometimes think of them as the modern science of getting back to the basics. I mean, some of these things, it's not that the facts are so complicated, I think they make sense when you say them. It's how do you actually do them in everyday life? I mean, I think most people would say that, yeah, I got to take care of myself enough if I'm going to be a strong parent or if I'm going to be at my best in when I'm practicing medicine. The question is what are the things that are getting in the way of that?
Mm-hmm.
So that when we look at looking at maybe approaching burnout and approaching how we're going to sustain ourselves as healthcare providers differently, um, we have to look at what we really mean by resilience and whether, we're sort of practicing what we know, so yes, it's good just, good to stay resilient, but what does it mean? What does it take to stay resilient? And that's where the practice of mindfulness can come in. Because I think there's kind of two things we can look at there very broadly, really broadly, when it comes to what are the things that are going to sustain us. Some of them are more kind of our mental world, and that's where the mindfulness practice comes in. I think that actually relates to what I said before about mindfulness be a way of living with clarity, because the other real huge disconnect in healthcare quite often is that there's physical things we need to be doing that sustain our resilience, and we lose touch with those completely. even though, they sustain our mental health also.
Hmm.
So, as simple as it is to say any of that, the practice is about giving us the tools to actually making it happen. So,
Right. And can you talk a little bit about how the practice, I
sure.
think for people who are new to mindfulness and meditating, they don't make the connection between how this practice of
Right.
sitting
Yeah. That
and placing your attention on something and steadying your attention can
right.
actually lead to um, increased resilience, increased capacity.
Yeah. I mean, that's the core of it, is like it's a bunch of words until you actually practice it.
Hmm.
And I think that's where I think reframing what mindfulness practice is really helps people stick with it. So, the basic practice most people start with, there's one of two, but they both focus on aspects of just physical sensations in the body, like breathing. So we'll start with, and really from the beginning you have to know you're not trying to make anything happen with that. It's just that when we're breathing we happen to be breathing, so our body moves each time, and that's something we can focus on that isn't the chaos of our thoughts. So there's research about how our thoughts tend to go in places that totally complicate our lives quite often. I mean, they're important thoughts too. I mean, that's part of problem solving, that's part of being a strong clinician, but a lot of our thoughts are like something challenging happens and then we amplify it by projecting it 20 years into the future, and we just can't stop thinking about that, and or we have some, regret about what we did last week or last month or last year that just keeps coming up chronically, and just our minds spin and we just get all over the place. And then also, when it comes to problem solving any situation, if we're kind of caught up in that stress and fear and everything else, and our mind's half somewhere else, we're not going to, handle the situation as skillfully as we could.
Right.
So this, so the first part of the practice is using something like breathing just to break that cycle. It's something we can focus on that's, clearly, I was about to step into cliche again. It's clearly here, but in a totally useful sense, not in terms of that cliche of like be here now or anything. I hate those
Right.
cliches, but just as like it's not your
Come
thoughts.
around to them again. I'm like, oh yes, be here now. It sounds so simple and cliche, but
Yeah.
oh, is it hard?
Yeah. Yeah, it's really hard to do, and forget the cliche. The point is that it matters, because any
Yeah.
moment you can focus on a few breaths, you're stepping out of that stress cycle. Like stress just tends to perpetuate itself. When you have stressful thoughts, they lead to stressful feelings. When you're feeling bad, it leads to different types of thoughts. When your body feels off, it goes to thoughts, to emotions, to this, to that. Sharon Salzberg, who's also part of this program, I know, talks about the idea in mindfulness of small doses many times a day, which is a really practical one for doctors of
Yeah.
just, stress, if we don't put some effort into it, tends to just escalate and become a chronic state because it does perpetuate itself. It just triggers our fight or flight response, and then we just live that way,
Hmm.
because all these things, like I said, they just play off each other,
Yeah.
and so small doses many times a day means once we become familiar with mindfulness practice. So again, the concept being that if we can just for a few breaths even focus on what's actually going on right here, which is I'm sitting here breathing. There may be stressful things I had to deal with earlier today, and there's some things I have to deal with later today. Right now, I'm just going to focus on a few breaths, try to let my thoughts settle, um, and then the thoughts are going to come again. I mean, that's another thing, is we can't quiet the mind, but we can change how we're living with it.
Hmm.
And that concept of just like breaking that cycle regularly becomes a habit. So one way to deal with it in medicine is just to get familiar enough that you have a few tools at your disposal that when you feel yourself getting too caught up in it during the day, you just take a minute or two and just hit the reset button. And if you do
Hmm.
that cumulatively, that has a long-term benefit. But I do think there's a really major reframe of the practice that matters too, because there's something that I think is often overlooked, which is for those few moments you're practicing. So, the practice of mindfulness is a little bit like a gym program. There's no warm, fuzzy way around that. I know like getting to the gym is a hard thing to do too, but it's a practice. It's something you do to sustain traits, just build the traits you think are valuable. And one of the core things we're building when we practice mindfulness, which is really different than we tend to be living, is just patience, because
Mhm.
if you can sit, this is separate from the small doses. Now, if you can just sit for a few minutes a day, so I know Dr. Jha is also part of this program, and
Yes.
her recent research is talking about just 12 minutes a day, in
Mhm.
that's what she's been talking about lately. So for those 12 minutes, what you're doing in many ways is directly building resilience and patience, because what you're practicing is whatever is going on for those 12 minutes, seeing if you can sit with it without reacting to it. And
Mhm.
it doesn't matter if it's good or bad, and it doesn't matter if your mind's busy or not busy, because busy mind is part of life. So what is it like to, for 10 or 12 minutes, just do our best not to get caught up in our thoughts so much and come back to the breath? And many ways we can explore that. But the short of it is we're building patience because we don't usually do that. So for 12 minutes, it's like, what if I can just be patient and um, tolerant of whatever's going on, even if it's not my best day, even if some other part of the day I have to be proactive and problem solve. Sylvia Boorstein recently said something I thought was pretty awesome, which is if you're practicing mindfulness and it doesn't lead to activism, you maybe, I forget, I'm paraphrasing her, but the point of it was, mindfulness inherently leads to activism, because if you pause long enough to see what's actually going on, you're going to want to do something about some of it.
Yes.
So the point isn't to be passive. It's just that while we're practicing patience. For these few minutes, even though I normally get frustrated and eat, I'm just going to notice I'm frustrated and not eat. Or
Mhm.
when I'm angry, I normally shut down or I yell at somebody. But for these 12 minutes, I'm just going to notice I'm angry and not do that thing I typically do. And that has huge benefits over time in life.
That is a powerful, powerful reframing. I think it's, a false impression of mindfulness when you see the blissed out, calm person, image of a calm person. What you're not seeing is the internal settling, which is, for me personally, a riot of emotion and body sensation, because I am a doer. And in order to stop, it takes a lot of work for me. And I know mindfulness isn't, it's not supposed to be work. You're supposed to release and let go. But the act of doing that for
No, that,
me is
yeah,
it's a lot. It takes a lot. So it's pushing through, for me, it's pushing through the pain, the discomfort, the boredom,
right.
eventually, and just noticing all of that and sitting with it. And that, I'm going back to Dr. Zhao. The whole reason why we're here doing this is because there's a lot of research on what that does, not just to our mental health, but physiologically in our bodies, how that, what is happening in our bodies when we do that regularly. Can you talk a little bit about the whole body, and what is happening when we practice
Sure.
mindfulness over time?
Uh, Yeah. Um, Actually, I just want to pick up one thread from what you were saying because it just came up the other day, and then I'll go to the science, which is you mentioned boredom. I mean, that's
Mm,
such a big part of our society now is that there's no opportunity for boredom because
yeah.
boredom's a little uncomfortable. So immediately, turn on the TV, get on our phones, this or that. I was talking to a friend of mine who leads a photography department, and we were talking about it in terms of creativity and how, downtime is where a lot of healing happens and also where a lot of creativity comes from.
Mm.
So letting our minds be a little all over, little bored, little bored probably serves a role in life. And so there is some effort into just over time breaking our own cycles. We each have our own stuff, and so there is effort to it.
There
It's
is.
sort of there's a paradoxical, like, we're not trying to force ourselves to be anything,
Yes.
but we are trying to let go of some of the stuff we're overly caught up in.
The act of
Which again,
allowing
that
is,
that may be sounding too wonky, but it is more natural than that. It's just like I said, for 10 minutes we're not doing our normal stuff, and that has a cumulative benefit. When it comes to the research around mindfulness, personally, I've always found that I feel really fortunate that right about when I started practicing is when the research started. So that personally, what happened for me as a clinician is I practiced 5 or 10 years totally on my own. And then just as the science was catching up, like this light bulb went on of like, this is really silly to be keeping this out of my medical practice. For me in particular, I work with families a lot, and there's just, there's a lot of stress to being a parent in general. In my field, I'm dealing with, um, or I'm helping people with a lot of situations where they're dealing with challenges around school, lots of, challenges, very emotional. And these tools to help parents and children navigate challenging situations, almost all the same things we're talking about around healthcare apply. So, so what's happened is that the research has taken off exponentially since the 90s. And at this point, there's hundreds of studies a year coming out about the potential benefits of mindfulness, which I think are important to put in context also. I mean, that may start to sound like snake oil, and you don't want to make claims that are
Right.
unrealistic. To me, I think one easy way of rationalizing it, making sense of it, is this is another way we can look at how the impact of chronic unmanaged stress, impacts everything. If our body's always in fight or flight mode or excessively in fight or flight mode all the time, that doesn't just affect our mental health, that affects our physical health.
Yeah.
And more studies have been showing benefits not just for things like anxiety and depression and burnout, but also two things I think are on the physical side. I mean, one is more general research showing benefits, for example, to our immune response.
Hmm.
Not a small thing to consider, considering what we're all living through.
Exactly.
And then there's also been, really wildly amazing research on how it affects our brain. And I
Yeah.
think that's an important. I mean, I imagine most people nowadays in healthcare at least are familiar with the idea of neuroplasticity, which is that our brain rewires itself constantly based on experience. And that is a complete overlap with why we're practicing mindfulness. Because actually, I'll start from more the psychological side of it, but then talk about the physical side of it, which is, we get caught up not just in sort of behavioral habits, but some of the mental habits we get caught up in, can be really pervasive and intensive. So there's the negativity bias, for example, which is one that, the scary stuff grabs and holds our attention. And that, again, if we don't choose to manage that, nothing about mindfulness denies this fact that bad stuff is happening, but it can be all consuming.
Hmm.
And if you look at the research into what helps us sustain mindfulness, a piece of that is actively choosing to give full attention to the more positive things in life. But that also takes effort,
Yeah.
on a really busy day to remember to just, give full attention to coffee with a colleague for a few minutes at lunch. Or are we having that cup of coffee while half thinking about something else?
Hmm.
On a really busy day, is it nice enough out where I'm actually looking at a snowy day? It's like on the walk to the car, can we just appreciate, the fact that it's kind of nice to be out in the snow for a few minutes?
Yeah.
And those things cumulatively help too, and gratitude practices and, really giving full attention to the positive stuff. Because if you look at it from a neurologic level, we can choose to put all our energy into all the things that sustain more reactive, angry, negative, all-consuming habits. Just keep feeding them however we're feeding them, either by staying in autopilot or by, choosing to maybe overly immerse ourselves in the news, or by, we all, again, everyone has their own spin on that.
Hmm.
Or we can choose to break that habit, because when you look at the concept of neuroplasticity, anything we do repetitively hardwires itself as a habit.
Hmm.
So our brains are, um, to at least some degree, trainable like a muscle. Like anything we reinforce over and over again develops a neurology to it. And that's why mindfulness practice becomes more intuitive if you stick with it. And some of the research around that has shown changes physiologically in as little as about, I think, I don't even, some of the studies have gotten really short, but certainly in as little as about 8 weeks of practice, and some of them, I think, even a little less.
Yeah.
So after a relatively, actually, for many people familiar with research, I mean, one of the things about all these studies is you don't even know how much people actually practice. So after doing an 8 week mindfulness program with whatever degree they were able to actually follow along the program,
Right.
you already begin to see physical changes in the brain. For example, I'm recalling one Harvard study that showed growth in the areas of the brain responsible for emotional self-management skills
Hmm.
after as little as 8 weeks of practice. And for me, as a physician talking about mindfulness, this is just I mean, I love this overlap of you can talk about mindfulness from the point of view of these ideas of, that there's just benefit to being aware at moment to moment. You're going to handle any situation better if we can build these traits that help us stay aware. And you can talk about mindfulness from a more traditional view of just this is the practice. But now we can combine that with all this science and research really backing up the fact that it actually works.
Yeah. And, just to talk a little bit about the kind of practice in those studies, you're talking about 8 weeks. A lot of those are sort of following, MBSR or MBCT and these other kind of very specific formal styles of practice.
So MBSR, by the way, stands for mindfulness-based stress reduction, which was one of the original programmatic ways of teaching mindfulness
Mhm.
in the West. And for research purposes, you need to be often, sticking to some sort of curriculum so you can compare things between different programs. However, there also is Dr. Jha's research, which she'll talk about, which talks about smaller doses than the full program. And and I wish I could quote more of the research directly myself, but I would say that I just finished a project with someone who is very interested in the impact of what's often called the informal practices of mindfulness,
Mhm.
and meaning the sort of small doses through the day, or trying to
Yeah.
give, the gratitude practices, the accumulative benefit of just actively trying to add these smaller pieces to our life.
Mhm.
And she definitely references, research benefits to some of these informal practices also. I mean, one of my favorite healthcare and research studies is one where they looked at something called using a gratitude journal.
Mhm.
So that's a way to put it in context of what we're talking about today, of sort of combating that negativity bias. It's
Right.
again, it's not
Yes.
false gratitude. It's not pretending we're happy when we're not. It's
Mhm.
really just recognizing that it's important to notice what's going well and to be grateful for, whatever there is to be grateful for in each of our lives. And that's part of sustaining our resilience. And what they did in this program, which I think was for healthcare providers, is they had them do the journaling practice. And the unsurprising part of the practice, because it's been shown before, was that people who did the gratitude practice for a while tended to feel happier.
Mhm.
The interesting part to me was they followed up several months later. And one of the hardest parts with research in general is that even when the interventions work, people don't stick with it outside of the study.
Right.
But around this study, most people stuck with it because they had found it so simple and beneficial that they chose to stick with it anyway, which I think says a lot.
That's amazing. And I think mindfulness research in general, though still in its infancy,
Yes.
is I liken it to when physical fitness was being studied and still in its infancy, and we saw people running in the
Right.
80s. Why are you doing that? Why are you dressed like
Yeah.
that out in the running on the road? But so I feel like we're in that moment now where we're looking at people who are meditating, like, why are you doing that? That's
Right.
very strange. But as the research grows, and it becomes really something eventually your doctor may prescribe, and I think in some countries doctors are prescribing mindfulness meditation, and I hope that that happens more here. Um, I wonder, just going back to the audience we're serving right now, which is the
Yes.
healthcare community, everyone from frontline workers and nurses to doctors to um, you know CEOs and leaders and managers. Um, One of the things that we don't talk about a lot is this sort of relational nature of the practice and
Yeah.
how it can help with connection and communication. And I wonder if you can
Mhm.
talk a little bit about that.
Sure. I think that's another way to reframe the practice that really, I think, helps people buy in,
Mm,
because one of the broader intentions of the practice, which I think most people find intuitive when you sort of step back and think about it, is that, if we're aiming to build our own resilience, to get out of reactivity, that's at least theoretically something we can all understand. Like if we're at our best, we relate to other people differently. So when we settle more, that changes how we interact with the world around us. Even if we just catch it for a moment, or maybe it's at the end of a vacation, or we just happen to be having a good week. And that premise that how we take care of ourselves, how we interact with the world, um, in, impacts everyone around us for the better is actually inherently part of the practice.
Mm,
So mindfulness can also get sort of pigeonholed as kind of like a self-help practice, but that's never been the intention. And if you look at any situation you're in, there's just sort of this, basic truth of cause and effect that we can't get out of, which is how we interact with that situation is all we control and influences an awful lot. One of the examples I give around family sometime, and it's a little loaded because I don't want to make anyone feel badly about situations because we all have them. But if you imagine, a really, really bad morning
mm,
where things just go off the rails and you get into a spat with your child and then you put them on the bus right away, which happens. I'm not saying it's never going to happen, but just the implications of that are, if you think about, well, in that moment, how is your child then going to interact with the other kids on the bus? How are they going to interact with learning during the day? It just has this ripple effect that affects more than just you.
yeah,
And on a morning where we're feeling a little stronger, or maybe been practicing mindfulness, and it helps us not get angry, by the way, we all get angry, but just maybe handle being angry differently.
right.
Um,
That is key.
then and we put our child on the bus, maybe managing just to reconnect for a moment before they get on the bus. It doesn't mean we don't have bad, again, some of this is just that bigger perspective of managing the situation as well as we can. So
Mhm,
now they get put on the bus after a moment of reconnection. How does that affect how they, talk to other people around them,
mhm,
feel during their day in the classroom. So there's this much broader effect around mindfulness practice. So even our basic breathing practice, which may feel like this is about me in some way, like I'm going to feel better because I do this. It's not really that. It's like it's that because we're aiming to relate to life as well as we can. That impacts certainly how we feel. There wouldn't I meant to say this earlier and I didn't, because we've been talking so much about how mindfulness isn't about X, Y, or Z. It certainly is about feeling better in the bigger picture. I mean, the hope is that there's less stress and that we feel better, and that's all part of it also. But, the much broader implication, the rationale for practicing as a parent, the rationale for practicing as a healthcare provider is very much that when we're more able to step out of, you know, autopilot and reactivity to just give full attention to whatever's going on, to sustain our own resilience, that fundamentally changes how we, practice medicine, or relate to other people or have a conversation, all of which are topics we're going to be covering during this conference.
mhm,
But the idea that, if even for a few minutes, when I go into, even on a really busy day, even if it's a very short visit, if I can come into the room and sort of gather myself for a second and sit and just try to be present for a few minutes, that makes a huge difference, not just in terms of how somebody else feels, but it's actually been shown, and you can start exploring the how and why of it. Like I said, there's going to be a lot more content at the conference, I think, that gets into the details.
mhm,
But if we can just give that awareness to the situation, that actually has been shown to help clinical outcomes too, because we're going to communicate more skillfully. We're going to hear, just read the situation differently. Maybe not, make assumptions that we might be bringing into the situation. All of
mhm.
which, just improves both patient, how the people we're talking to feel, patient satisfaction,
That's right.
but also almost certainly is going to start affecting, our practice of medicine too. And I should end this thought by saying all of which can be done in ways that don't add time to our clinical day. So
Right.
it's not like we have to, slow down and take twice as much time per visit. It's that while we're spending a similar amount of time per visit, we're going to relate to that situation differently.
Yeah. Um, there are two things that I want to touch on there. And one of them is, and maybe it makes most sense here, can you just talk about the practical ways that healthcare professionals can, throughout their day, be incorporating this practice? I mean, we've talked about it a little bit, but very concrete moments that somebody can take, um, and what they can do during those times to tap in,
Sure.
what it looks like for healthcare.
Right. I think the simplest one to start with is something that's sometimes called a doorknob practice in medicine, which is, there are countless times during the day we have to stop for a second and we're about to go into the next room. And it could be with, in patient care, it could be actually just be meetings and other things we need to be doing.
Mhm.
And the doorknob practice that I most often reference, and and I've lost track of who to attribute the practice to, but there's a widely quoted practice called a stop practice.
Mhm.
So stop stands for, it's an acronym that stands for stop what you're doing for a moment, take a few mindful breaths. And then, again, this is one of those things where like take a breath can be like a almost stress producing cliche. So because like when people say take a breath, like with that finger pointing attitude, they really mean like, shut up and quiet down.
Yeah, calm down.
But right. But take a breath in the sense of just like physically focus on a few breaths, because that's a way of helping recognize that we're going room to room to room. And whatever's worrying of us about that last discussion, whatever's worrying of us about what's coming next right now, this is the next visit that matters. So take a breath in the sense of like focusing on just in an unforced way on the physical sensation of a few breaths. The O stands for observe, which is kind of like a check-in. Like, how am I doing mentally? What's actually going on right now? What's the and then the P stands for, use it a few different ways, but basically pick how to proceed. Meaning, what's next? Actively deciding where should my what needs to happen next? Where should my awareness be? Mindfulness is all about reality. If the reality is you should be somewhere else, go. But
Right.
the probable reality is, okay, whatever's going on for, 5 minutes, 15 minutes, I need to be here. So
Right.
it's a way of, um, so it's a lot of words for what's a very brief practice. So it's like you put your hand on the doorknob, take a couple of breaths, bring yourself back. And then when you go into the room, try to sit and try to, just give full attention to that, whatever's going on there. And that is one practice that I often talk about during medicine is just, oh,
Yeah,
please go ahead.
I would love to just talk about this practice just for a moment because I think
Sure.
some people hear this practice and they think, the P is proceed. Just keep going. Whatever you were about to do, keep doing. And I just want to back up and note that, that breath and then the observe really is an important piece where the truth of it needs to come up here in there too, where what are you observing? Are you observing that your breathing is shallow and that you need a little more time?
Yeah.
What
Right.
are you observing in that moment
Right.
that you
Well,
can then proceed with?
right, right. Well,
What
actually, oh no,
go ahead.
go ahead.
No,
No, I
you
was
go.
going to say there's two things you can nuance. The
Yeah.
O, in terms of observe, there's
Hmm.
a lot. It's really, again, when you talk about the fact that we're developing patience,
Yeah.
one of the nuances is that if you can observe the fact that you're feeling irritable,
Hmm.
that actually changes how you behave.
Yeah.
Because, if you can be really aware of like, okay, I am having a really bad day, but now I need to do this, now this is where I need to be doing that. If we're caught up in our fear and reactivity or whatever, again, I keep using those same words. It's different for everybody, but the negative stuff,
Hmm.
and we don't notice it, then that irritability is just going to influence how we talk and how we act as we go into the next room. So even without being able to fix that irritability necessarily,
Right.
just being able to recognize like, okay, it's one of those days, that really makes a big difference. And by the way, this does have cumulative benefit in different ways that come back to our own resilience a little bit, because if that allows us to connect with somebody differently, that human connection and social connection actually helps, as opposed to if we're just like on our irritable autopilot and pushing everybody's buttons, that
Right.
affects them and us both. So the O can be really nuanced. There's a lot to it. That's the whole practice of mindfulness, really. So even though it's a quick practice, there's layers to explore. But the important part of the P actually isn't that we just proceed. It's that it's about intentionality. It's
Yes.
that we pick how to proceed.
Right.
Meaning, we might normally go down this rabbit hole, but
Hmm.
I'm catching myself and I'm going to do this instead.
Yes.
Or my rabbit hole is perfect. I mean, one of the things you could just say, no, the typical works, but
Hmm.
but we're being intentional about how we're relating to whatever's going on instead of, staying caught up in things. And that's the important part of the P actually.
I often hear mindfulness talked about as a practice that allows you to have choice.
Yeah.
so you get to
Yeah.
choose how you move about your day in every
Sure.
moment, in as many moments as you can be aware of.
Right. Right. Right.
Thank you
Um,
for
you're
backtracking on
welcome.
that
Yeah.
practice. You were about to
Sure.
mention another one. Yeah.
Oh, there's another practice, and it'll actually, um, I'll talk about it first, and I know we're going to do a practice, so it'll probably make a little more sense when we've done the practice, but I'll frame it a little bit.
Okay.
There's a practice I came across years ago called the 15 breaths practice, or you could actually do it as a 10 breaths practice. And the basic premise of it is that 10 or 15 breaths takes less than a minute for most people. And so once you get used to it, so in other words, once you're familiar with mindfulness practice, you can take 10 or 15 breaths, just aiming to give full awareness physically to the breath. And that sometimes most people can manage an attempt at that. And the author of that article said that if you can do that once an hour for a day, you've probably practiced 10 or 12 minutes that day, and
Yeah.
that's just great. And that's so that little practice of just like regularly through the day, just like stepping outside whatever's going on,
Hmm.
choosing to settle, getting back on with your day does have cumulative benefit, at least in how we're living. Like you
That's
said, I don't know what the
your
research
science
would say.
back 12 minutes, right? So
Yes, yes, there you
wonderful.
go. So
Yeah.
that would be an interesting study, although a really hard one to build, I would imagine. Um, so
Well,
once you're familiar with breathing practice and it's just part of your tool set, those little just repetitive moments matter. Um,
and maybe before you lead the practice, I just have one other
yeah,
thing I wanted to just touch
sure.
back on, which is that, we keep talking about what's difficult, it's
Mm,
acknowledging the
right.
difficulties. And I just want to go back and acknowledge again where we are with this pandemic and the fact that
Mhm,
we have so many people leaving healthcare because,
mhm,
you know, it's just gotten to be unsustainable.
mhm,
And we can talk. We have many actually moments throughout this conference where we're talking about the systems that people are working within and how mindfulness can show up in those systems. But I wonder if you can just address someone who is at that point of burnout, of being like, I signed up to help people and this is too much. Um, how can the practice show up for that person?
um, well, that's almost too big a question. But again, I don't want to address because individually people are suffering in such specific and in sometimes challenging ways. Some of what you're asking really just overlaps with the level of mental health crisis going on in this field, and you don't want to sell mindfulness as a panacea for everything. So certainly there's a need for therapy. There's a need. Some people need to take a break. I mean, all those things are real too. I don't want to overly simplify things. I do think that it's interesting. You and I think alike. I think about some of these things because one of the things I was thinking as we transition to the practice that we hadn't talked about, which does relate to your question, is that a lot of the practice of mindfulness has to do with paying attention to what's actually going well,
Mm-hmm.
which is easy to completely lose touch with. And so when we say giving full awareness to what's going on, we've been talking a lot today about using that to navigate challenges. The truth is that part of sustaining the value of being in healthcare and feeling good as a provider and not getting burnt out has to do with coming back to some real sense of that human connection that got us here in the first place,
Mm-hmm.
and looking at um, so you can use the practice as a way to reconnect with people, reconnect with the fact a sense of purpose, which is an important part of sustaining resilience, which we can lose touch with, and then remind ourselves, like in an active way, like this is why I'm doing this, and then try to find those moments through the day that build that back up. And that's certainly one part of it. And then the rest of it, just to, because we're going to close soon, just to, come back to one of the things you mentioned at the beginning, is both mentally in terms of all the things we talked about the practice itself, and also in day-to-day life, maybe really just getting out of autopilot. One of the best pieces of advice I got going into medical school was find one thing that keeps you sane, and whatever happens, don't let go. Um, and
What's your
um,
one
and
thing?
it was my thing back then was ultimate frisbee. So I played very competitive ultimate frisbee for many years, and I just made sure that as busy as my life got, I was playing many times a week, and it was awesome. Well, I wasn't always playing many times a week, but I was trying to, and
Right.
I
You
fit
knew
in
it
my
was there for
schedule,
you.
but I
Yeah.
was doing something at least.
Yeah.
But it could be anything. So the point is that to try to keep it shorter for today,
Mm,
is just that there is a lifestyle side to, if you look at the broader idea of practicing mindfulness in terms of like being aware of how we're living, which is part of
mhm,
it. We have to get out of autopilot to do that. You have to like finish this talk and sit down and say like, okay, like what are one or two things I can do that are realistic,
mhm.
not just like just like what are steps I could take. Because that's any habit formation is always about small, realistic steps that are reinforced. So not I'm going to suddenly change my entire lifestyle, but coming back to the basics a little bit of we don't always emphasize enough like sleep, exercise, nutrition, sticking with the hobby that keeps us strong,
Mhm.
connecting with the people that keep us strong. So in the broader sense, I mean, often when we're talking about mindfulness, like I said, we are talking about like what it means to meditate. But in the broader sense, it's using that sense of awareness to make sure we're living in line, aligned with what we believe and know. And certainly in navigating any crisis, you know, making sure we have that foundation that keeps us strong, even if it's just for stretches of time, just that one thing, but in the bigger picture, a lifestyle that helps us sustain our well-being is certainly going to be a piece of, staying strong and not falling. We're going to be stressed, but maybe staying out of burnout.
Yeah. And then I think, as you were saying, sometimes just that recognition of, oh, I am in burnout. And what's the next thing I need to do? You know?
Yeah, I mean, it is a huge step towards self-care to just acknowledging what we're really feeling,
Yeah.
which is certainly, again, part of mindfulness practice and not
Mhm.
what we're taught in medicine a lot of the time.
Yeah.
To really acknowledge this is how I feel right now, matters a lot.
Yes. Because your body knows, and your body will
Yeah,
tell you sooner or later.
well, yeah, it's true. It's
So
going to
you want
come
to,
out somewhere. Yeah.
that's right. That's right. Well, how about you lead us through that practice now?
Okay.
Thank
So
you.
I'm just going to lead a breathing practice, but I'm going to do it through this lens of practicing patience, really. So what I'd like everyone to do, if you're not driving, is find yourself a comfortable posture, one that feels kind of alert and balanced. So sometimes it's described as like you're a puppet and there's a string lightly pulling up, and that posture helps you stay alert and the more balanced it is, it's easier to sit still. So it shouldn't feel forced, but it should feel active a little bit. And then as you settle into this posture, begin to notice that there is a physical sensation that your body makes with each breath. So you don't have to do anything special with your breathing. And if it's helpful, you might label that movement breathing in and breathing out. And your mind almost certainly stays busy. That's normal. You're still having thoughts, they'll keep going. So the practice is noticing when you've gotten caught up in that again, and then coming back again to breathing in and breathing out. And as you sit here, you also might notice almost any type of physical sensation. There might be a sense of comfort or discomfort, of hunger or satiety, Parts of your body might feel relaxed, parts of your body might feel tense. There's so many habits we fall into when our body prompts us in this way. So, seeing now for the next minute or two if we can observe whatever is going on in our bodies, and whatever we notice, unless it's very extreme and needs attention, for everything else coming back to the breath. Letting go of any sense of needing to fix or change anything for a few moments. And then shifting your awareness to your emotional state right now. You might feel relaxed, you might feel restless, you might feel anxious, you might feel at peace. And with that same sense of some other time of the day, there might be things you can do that help you feel better. But for these next few moments, seeing if you can acknowledge whatever your emotional state is without needing to push away from it, without needing to change it, just recognizing this is how I'm feeling right now. This is what's going on. And if that gets difficult in any way, just coming back to breathing in and breathing out. And then you'll probably notice thoughts. Thoughts keep happening. There's no goal of a totally still mind or a totally quiet mind. And those thoughts could be taking you into the past or the future, or quite commonly judging your practice in some way. I'm terrible at this. This would be awesome. So in that same way, seeing if you can notice thoughts are thoughts. My mind is busy. And even if you stay caught up for what feels like quite a time and come back for one breath, that's perfect. Just noticing and coming back again, breathing in and breathing out. So for just a minute or two before we end for today, just setting that intention of this is my experience right now, and letting go of any sense of forced effort or striving, and letting go of any sense of needing to change anything or fix anything in this particular moment. just sitting for a few minutes or a few moments, breathing in and breathing out. And when you're ready, opening your eyes and finding a moment to bring your awareness back to our virtual classroom. So thank you.
Mm, thank you for that, Mark.
You're welcome. I'm glad to be here.
Well, is there anything else you would like to say to um, our audience joining us here today before we give them a little bit of information about how to find you and your work?
I mean, like, I think the most important thing to end with might have been something I mentioned along the way, which is, the practice is all about hearing all this stuff and then making it real for yourself. It doesn't, that's probably the bottom line is whatever you're hearing, see if you can find the reality behind it and if it makes sense in your life.
Mm, thank you, Mark. So, how can people find you after this if they're interested in learning more about your work?
Um, I think the easiest thing is just through my website that connects to most of the places you can find me online and everything. So my website is developmentaldoctor, all spelled out.com. I also have a fair amount of um, practice in writing at Mindful, so that's another way to find me.
Yes, you do.
And
Mm,
but I think in terms of most of the things, if anyone's interested, most of the things I'm doing are on my website.
great. And we'll include a link in the resources posted under this session.
Good, great.
So thank you everyone who joined us here today. Just showing up for this session is you showing up for yourself. So we just appreciate you being here with us. And there is a short feedback form at the bottom of this window. You can click rate this session. And if anyone feels inclined, please do so because your feedback helps us create the moments that will serve you best. Mark, thank you so much for joining us here today.
Oh, thank you, Heather. It's always great to see you.
It's always great to see you.